Hi, my name is Kalen Reed. I'm in Section 2. I'm doing my secondary IV administration. For my primary, I didn't say that my vancomycin was Q6 hours, and I didn't say that I looked at the lab, so I'm correcting that. Now I'm moving on to my secondary piggyback, okay? I'm going to come in the client's room. Hi, how are you doing? My name is Kalen. I'm going to be your student nurse today. Could you state for me your name and your date of birth? Okay, perfect. Mr. Jackson, do you have any allergies that you know of? No? Okay, good. I didn't see it in your MAR either. Do you know of any drug-drug interactions that you have? No? Okay. The doctor prescribed Zosyn 3 milliliters. It's 3 milligrams per milliliter. Okay, I did my dosage calc, and with it being 3 milligrams per milliliter, with my 10 drop factor, I come up to 17 drops per minute. My availability, and it is administered Q 30 minutes, the infusion time is 30 minutes and it's Q6 hours. Okay, but before I would even give Zosyn, as you said, you said you had Zosyn before? Yes, okay, good. So you know about it. It's an anti-infective. I also look at my drug book for the action, the side effect, the nursing implication, and the infusion time, which is 30 minutes. Okay, and I'm going to look at that site that you already have your primary in, and everything looks good. No signs of phlebitis or infiltration. Perfect. Okay, so a little bit of hand hygiene, and I checked the expiration date on the bottle. Everything looks good. So we're ready to administer, and I checked on my MAR. I looked at my labs, my allergies, checked my medication once again. Everything looks perfect. Okay, so I'm going to go ahead and get ready to administer my medication. Prepare it. Alrighty. Okay, so first thing, I'm going to clean the tops with alcohol. I would go in the trash, clean this, and clean this. Alrighty. Go ahead and get my 1 milliliter, double check my dosage cup once again, 1 milliliter, inject it with air, back, pull up 1 milliliter. Perfect. Okay. Alright, go ahead and administer my medication into the bag. Alright, perfect. Okay, this would go into the sharps, and I would gently mix my medications. Everything's mixed and ready to go. Okay, now for my tubing, before I do that, I need to put my label on here. And that's my bag. I've got my client's name, the drug, the dosage, the time, and my initials. Okay, and then I'm going to go ahead and label my tubing. That's got the date, time, and initials on it. Okay, there we go. Another piece of tape on there, but not where it covers up the words, the letters. Okay, and now I've cleaned the top of this, so I'm ready to go ahead and spike my bag. I'm going to spike it. I'm going to make sure that it's primed. Okay. Okay, perfect. Okay, check my drip chamber. Everything looks good. So that's ready to go. I'm going to go ahead and put this here while I prepare everything else. My Zosyn, which is infusions over 30 minutes. And I would probably get my new drug label and put this back on. Get a piece of tape. Make sure that was on. But my bag needs to be facing the other side. There we go. Alright, so that's hanging and waiting. Okay, so now at this point, I'm going to check that primary IV again, make sure there's no virus infiltration, and we're good there. Okay, so now I'm going to go ahead and get ready to clamp off your primary. primary vancomycin. So that's clamped. I'm going to go ahead and take it off. And I'm going to hang my primary bag lower as it's already clamped. So where my piggyback runs, this is lowered. Okay, let me get an alcohol wipe. Okay. And I would go ahead and clean this insertion site. Okay, that would go in the trash. This down. Okay. I need to check it's still clamped and then check my drops per minute. Connect it before I do that. Okay, that's connected. Check my drops per minute and my clamping. Okay, perfect. And it's at 17 drops per minute, like I said that I calculated in the beginning. So that's good. Check that site once again. You feeling okay, Mr. Jackson? All right, good. Okay, so now that's running. It's going to run for 30 minutes. I'll make sure everything's in the sharps in the trash. Document that I did administer it. And I'll come back in 30 minutes to check on you, okay? And the site still looks good. I don't see any signs of infiltration or phlebitis. So I'll come back in 30 minutes and check everything, okay? Alrighty, let me know if you need anything at all, you feel any pain or anything. Okay? Alright, Mr. Jackson, how are you doing? It's been 30 minutes and it looks like your medication has went all the way through. I'm going to go ahead and put on some more hand hygiene. And you want to go ahead and say your name and date of birth for me just for safety reasons? Okay, good. Alrighty. Okay. Okay, let me go ahead and put my gloves on since I just did my hand hygiene. And let me look at that site. Everything looks good at the site. Okay, good. Alright, you're feeling great, right? Good. Okay, I'm going to go ahead and get that vancomycin going again. Your primary. Alright. Okay. Alright, so now let me go ahead and grab this. Okay, and that's all the way given. You're doing good. Okay, and the site still looks good. Alright, I'm going to go ahead and clamp this. Okay, clamped. Unhook this, and at this point I would make sure there was alligator clamp for the next administration if anybody had to give one. If anybody had to give another secondary or anything like that. Go ahead and take this off. Okay, and hang this back up where it goes, hanging just as a primary with no piggyback. And we tolerated that medication well, so that's good. Okay, and do my, check my drops per minute and my unclamping. Okay. And we still have a 17 drop per minute, so that's great. Alright, and I don't see any inflammation or anything. The site's looking wonderful today, okay? And I'm going to go ahead, just to be safe, is go ahead and clean the spot where you had the piggyback to, so you don't have the risk for infection or anything like that, okay? Just want to keep it clean. Okay, at this point in time, my vancomycin is running my 17 drops per minute, okay? I'm going to go ahead and get ready to document, and I would document that I did use the MAR to verify my medication. This was at 0300. I did my dosing, and no phlebitis, redness, or swelling at the IV site, no infiltration, no signs of that. The mini bag will use my regular milligrams per milliliter, 15 milliliters. Record intake and output, and the patient tolerated everything well. Okay, and that's my documentation. And I would say if my patient needed anything else, do some more hand hygiene. Tell him to call me if he needs anything.